Hey everyone, welcome to Humpday Happy Hour, hosted by Dentists in the Know. This is the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We're pulling back the curtain on the industry. We are talking to experts, we're talking to educators, we are talking to innovators, and the everyday clinicians who are out there doing all the work. There's no fluff, there's no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs, or maybe it's the latest scandal at the ADA, we're probably already talking about it. And yes, we are bringing the goods. It doesn't matter if you're in the dental profession, if you're a seasoned doctor, maybe you're a curious consumer, which is what we hope, because here we are to talk to you, the consumer, tonight. Or maybe you're just here for some of the banter. We welcome you all to the show, because around here, we're not just in the loop, we are in the know. Hey there, everyone. I'm Dr. Jeff Horowitz, and I am accompanied by one of my best friends in the world. He also happens to be a great clinician and educator. His name is Dr. Chad Duplantis. Dr. Jennifer Bell, who is also a great educator and dentist, is not with us tonight. She has her family on a beautiful trip to Japan, which we can't wait to hear all about. But we created this humble little platform together to make the dental world just a little smaller, but a whole lot more fun. Today's topic is really for you, the dental consumer. It is not sponsored by anyone. We are just here to talk truth. And tonight's topic revolves around dental insurance. My good friend Chad said to me, Jeff, let's do a consumer-facing episode. What do you want to talk about? And I said, the first thing that comes to my mind is the question that we hear 10,000 times a day in every dental office, which is, do you take my plan? And do you ever hear that question, Chad?
No.
No, never? Just me?
Nope.
Just Conway, South Carolina, Myrtles Inlet, South Carolina. That's it. Gotcha.
Yeah, and while we're talking about this, actually, I do hear it all the time, but I have to tell you, I'm going to, talk amongst yourselves. I found something just today from our local neighborhood group, and I think it's something worth talking about. So I'm going to pull it up while we're speaking. But
go ahead and pull it up, because I want to mention that so many, just what you mentioned about these public groups. We always hear people talking about dentists, and it's almost never about the quality of the work. Most of the complaints about dentists or the dental profession have to do with discrepancies over what insurance paid and over what the billing was. So I'll let you kind of take it from there. But I know that that's what's on social media sites most of the time.
Well, it's funny, Jeff. As I go through this, we always talk about this stuff, but it's freaking fantastic. I'm looking for someone. I found someone who's looking for kitten milk. Do you happen to know how do you even milk a kitten, Jeff?
You just grab the teat.
That's right, man.
You just grab the teat.
That's right. And what was that cat's name?
I don't remember.
Geppetto.
Geppetto.
Yeah.
All right, little Meet the Parents reference.
There's a lot of posts in here, but hey, while I'm trying to find this post, why don't you tell our nice friends that are with us tonight what our platform is all about?
So we are Dentists in the Know, and this is a platform that developed during COVID. Dr. Chad and Dr. Jennifer and myself, we were all educators. We were all pretty busy out there at continuing education events and just always communicating with the rest of the dental community and the researchers, all of the people who have really made our profession what it is. And during COVID, that all shut down. We got really, really bored. So we decided to create this little platform where we could just get on and nerd out together and talk about dental stuff. And for the longest time, it really was focused on the dental practitioners and the offices. But what we moved to now is we found that many consumers, many dental consumers, were really asking a lot of questions that weren't being answered. So our goal with addressing the dental community was we did not want to be sponsorship driven. That is, we didn't want any content that we provided to be driven by people saying, here's money, we want you to talk about this. Our platform was about truth. Our platform was about talking about the realities and the things that we do in our dental practices every day, the things that we see, and the things that we as educators could stand on a podium and feel very confident about as far as the quality of science that's behind anything that we recommend or anything that we say. And what we found was we had a lot of consumer inquiries who had found our YouTube site that was really geared more towards the dental profession. And we thought that we could be of great use to the general public in the same way in just bringing some truths about dentistry and the dental profession to the public. And so here we are, and that's where this episode came from. Did I buy enough time, Chad?
That was well stated, and I did find it. But
Okay.
before we get into it, we're going to talk about a lot of things. And Jeff, by the way, great job on explaining who we are and what we do. But one of the things that I want to say is this episode is not meant to disparage any dental insurance company whatsoever. As much as
I freaking hate them, Chad.
yeah, as much as we may or may not be fans of dental insurance, it is a fact of life, and it's something that we all as professionals have to deal with on a daily basis, directly, indirectly, or just, if we don't accept it, being able to explain it to patients. It is a fact of life in our profession that we have to understand and deal with dental insurance. So with that being said, before we go too far, I think it would be great if we break down, there's basically 4 types of dental insurance, okay? There is we'll talk about each one of these in depth, but there's an indemnity plan, there's a PPO, there's an HMO, and there's a DMO. And beyond that, the other thing that we need to understand is if you work for a large corporation or if your insurance policy is from a large corporation, it may be an insurance policy that is basically funded by your company, but managed by a insurance company. And that's the way that a lot of these large companies work. They have they have funds that are set aside. It's more efficient for them to do this. And they may contract, let's say, Delta or United or, United Concordia or Aetna or MetLife or whoever to just kind of manage what they pay out to employees. But it's all insured through the company and through their profitability. So
Chad, I want to interrupt you there because I think that that's fundamentally one of the grayest areas in insurance. So, people say, do you take my insurance? I have United Healthcare. Well, one United Healthcare policy may be entirely different from another United Healthcare policy for some of the reasons that Chad just mentioned. Is that basically every employer or every funding group gets to make decisions about things that they want included in those policies and things that they don't want included. So some of it comes back to employer choices. Some of it comes down to basic policies of the insurance company.
Right. And the other thing is that treatment that is necessary is deemed by your provider or your dentist in this case, not the insurance company. If they say that they're not going to pay for something, it doesn't mean that it wasn't necessary. It's just a bunch of hoops that we've got to jump through, and it may or may not be something that is deemed in their policy as necessary. And I also want to go ahead and say this, and I have no problem saying this. Insurance companies are exactly what they are. They are companies. And any company, unless it is a not-for-profit company, is out there to earn a profit, which means they are there to make money. When you're making money, you try to spend less money. And I don't think I said anything inappropriate there. I didn't call anybody out, but I think we could all agree upon that. Is that correct, Jeff?
100%. But there's another piece to that I really want to elaborate on, which is that whole not-for-profit. I don't want to not scheme, the whole not-for-profit business model, because what not-for-profit means is that at the end of the year that the balance sheet is just zeroed out. That is, that after all of the income and all of the expenses, that there's just a zero on the bottom line. But it doesn't say anything about how the monies are to be spent. So you know what are all legal business deductions are salaries. So very often, and again, this is not to disparage anyone, it is what it is, but I will say to call yourself a not-for-profit organization and you're paying your CEOs or more than $20 million a year, that's how you zero out the balance. You pay big salaries and you can now zero out that balance at the end of the year and still call yourself a not-for-profit organization. And so again, you're being the nice one here. You're being the good cop. I'm being the bad cop. And so I'll probably be the one with the IRS at my door tomorrow morning. But the concern that I have is that when you don't raise annual allowables, and we'll get to that, annual allowables in just a little bit, when you don't raise those amounts for the people who have been paying into your insurance for all those years, and when I say all those years, I'm going back for some companies, this goes back to the 70s, that annual maximum allowables have not been increased. And so when you go that amount of time without an increase and you have CEOs and upper management, earning millions and millions of dollars, I think there's a problem there. And how we address that, I don't know. But it's definitely something that needs to be addressed.
Well, before we get there, let's break down basically the 4 different types of dental insurance, because I have some statistics that I share in some of my presentations that are regarding payouts and whatnot. But let's talk a little bit about, when you have dental insurance, you really need to look at your card, okay? And your card will say, whatever the insurance company it is, and it may not have anything after it, which could be good or bad, but it should have, whether it's a PPO, an HMO, or a DMO after it, okay? So let's talk about, if you have just a generic insurance plan, which is an indemnity plan, you can go to whoever you want. Now, that doesn't mean that they're going to pay the amounts that provider charges, but it means that they're not going to tell you that in order to get the maximum benefit, or the best, I shouldn't say the maximum, but in order to get the best benefit, you have to go to XYZ provider. And that's what we refer to as an indemnity plan. You could go to Jeff, you could go to myself, you could go to John Smith, you could go to Jane Doe, you could go to whoever you want that's a dentist, and they are going to pay what they refer to as usual and customary fees. All right. Now, those usual and customary fees are set by the individual insurance company. However, on an indemnity plan, which we're speaking of, they don't care who you go to. They're going to pay those fees whether you go to Jeff or myself or Jennifer or whoever. They're going to pay those fees.
So whether you go to Chad or a good dentist, it doesn't matter.
Does not matter. It does not matter. Now, the second tier, in my opinion, is a PPO or a preferred provider option or preferred provider network. Now, what this means is that they will pay usual and customary fees to in-network or out-of-network providers. However, the fee that they pay is guaranteed if you go to a preferred provider. Now, one of the things that really, really bothers me on this is that I don't participate in any insurance plans for a number of reasons, and we'll get to that later. I've been very blessed in my career that I haven't had to. However, if you don't go to a preferred provider has, let's say a cleaning is $110. That's the contracted rate. They will pay $110. If you go to a non-preferred provider or somebody who is out of network, then they will pay $110. If that cleaning is $178, you will be responsible for $68 of that. Did I explain that well enough, Jeff?
Yeah, I think that was perfect.
So although it says that they will pay 100%, they will pay 100% of their usual and customary fee, which is what the preferred provider is contracted to be paid at. They could have whatever fee that they want, but you're not responsible for the other $68 or whatever it may be. If you go to an out-of-network provider, you are responsible for that portion. Now, the difference is usually not that drastic. I'm just throwing numbers out there so that I can add and subtract quickly. But, preferred provider is a very, very friendly network to be in because you can choose to go into your preferred network or you can go out of it, and they are going to pay something to everybody.
Hey, let me jump in on a couple of distinctions about, what usual and customary is, because a lot of times people who have these PPO plans, they will come to a dentist that is not signed up with them, meaning not contracted with them. So they are not a preferred provider. Now, what they are calling usual and customary is kind of a smoke and mirrors thing, because that is not usual and customary for what most dentists are charging in a given hour, in a given area, That is their contracted amounts. So a contracted amount should never be called usual and customary. And contracted amounts are typically anywhere from 20 to 30% less than what the true average fees for a given area typically are. And this is done with the promise that, hey, we're going to bring you more patients because you're now a preferred provider. So I just wanted to make those distinctions for everyone as you were discussing that.
Yeah, and Jeff, while we're at it, we've already talked about indemnity. We talked about PPO. You want to talk about HMO and DMO?
So, again, these are HMO and DMO are a couple of things. A health maintenance organization. Let me, I'm actually going to draw some of the true definitions of it. I printed some of this out because I don't want to misrepresent anything in this. But HMO is a health maintenance organization. So it's a managed care model, and it's designed to reduce healthcare costs by reducing care to only participating providers. So a patient would select a primary provider. They have to stay within the network. They will absolutely need referrals from those primary providers in order to be able to go to specialists. And providers are typically provided a fixed amount for each patient. So there are a couple of advantages to that. There's lower premiums, there's lower copays, and predictable costs. But the problem with an HMO type of policy is that you will be very limited in your provider choices. You're going to have a lot of restrictions when it comes to specialists, and there will definitely be less flexibility with regard to treatment choices. So that's really the idea behind a HMO. A DMO, or a dental maintenance organization, is kind of the dental version of what an HMO is in medicine. So again, you have to use participating dentists. It requires choosing a primary dental office. Services are provided according to a contracted, again, not usual and customary, a contracted fee schedule. And dentists are frequently paid through capitation, meaning they're paid often per person versus by the procedures that they are doing. Again, the disadvantages here are going to be a very limited provider network, limited benefits outside of the network, and again, fewer treatment options. And what I caution people about is, dentistry, and again, Chad and I are open books. We talk truth in every way. When we talk about typical general dental practices, most of them function at about 70 to 75% overhead, meaning for every dollar that comes in, 75 cents is going out the door in overhead. Many of these contracted amounts are between 20 and 30% below what usual and customary fees are. So think about this from a business perspective. If the average dentist has an overhead of 75%, and someone comes in and says, well, we're just going to take 25% of the fees away, then that leaves zero for the dental office. And nobody can function like that. So how are some dentists able to accept these contracted amounts and some dentists not accepting them? Well, typically your solo practitioners are going to be the ones, and your small groups and solo practitioners, people with a lot of technology in their office, people who are spending a lot of time with their patients. They cannot, it is not humanly possible to accept 25% off of your fees when your overhead is already at 75%. So most of those dentists would say, you know what? Rather than making zero at the end of the day for the procedures that we're providing, I would rather do anything else. I'm going to charge my fee. I'm going to have fewer patients, and I will have patients that come to me out of network, but I'm going to provide the level of care that I've always provided. Very often, large groups, corporate dentists, they have a system where they have been able to lower overhead because they're part of such a large group, and they're willing to take that hit in order just to have more patients in the group. But the downside is very often you're going to have lesser experienced dentists. You're going to have kind of the people who are just trying to fill chairs for the time being. So I hope nothing I said is out of line, but it's as much the truth as I have seen it over my 30 something years in practice.
It's very true. And the thing is that when we go through those insurance plans, there's a cost that you pay every month to, or annually, to be part of those insurance plans. And usually the cost goes down, most expensive being indemnity, the second being the PPO, which is the majority of dental plans, the third being HMO, and the fourth being DMO. And so, are there good dentists in every category? Absolutely. There are good dentists in every single category for a number of reasons. However, the longer someone's been in practice, it's kind of our observation, if you will, that you start graduating towards the PPO and finally just towards the indemnity, or you become a cash only practice. And there's nothing wrong with any practice model. But one of the things that upsets me, and actually before I get to this, I'm going to say this, is that when we look back, and these are factually based statements, when we look back, so let's go back to, for those of you in the Northeast, kind of the last time the Knicks won a NBA championship. But for the majority of America, we could go back to the 70s. The average dental insurance reimbursement maximum per year was $1,000 to $1,500. Modern day, the average dental insurance reimbursement maximum is $1,000 to $1,500. Now, some are $2,000, some are $2,500. Back in 1970, when the maximum reimbursement was about the same, the average crown cost about $100. Nowadays, the average crown cost is about $1,460. There is a close to 1,400% increase in fee, yet a 0% increase in maximum insurance reimbursement. Now, I can't say what happened to your premiums because I do not know the answer to that, but I can say that $75 billion is spent on dental insurance every year, and approximately 60% of that goes towards actual dental care. Now, one of the things that we're looking at is there was a, what is it called, Jeff, out of Massachusetts, the medical loss ratio, to where a certain percentage of those funds, I think it's close to 85%, don't quote me on that, but a certain percentage
have to go to patient care.
What you pay into your dental care needs to go. Now, this isn't per patient, this is overall. So if an insurance company X took in $1 million, which is way more than that per year, $850,000 of that would have to go towards actual care. So I believe it's called a medical loss ratio of 80 to 85%, whatever it may be. And I think more states need to institute this because the
100%,
the other 15 to 40%, wherever it falls, goes into profit. And so I think that if we're paying an insurance, first of all, as a patient, go to the dentist. That's what it's there for. Go to the dentist. Secondly, let's fight that our insurance companies have to put out the money that's put in towards dental care. And I think we'll see some changes. The other thing that needs to happen
it's like salary capping in sports, right? Because we got to a point in sports where only the largest markets were going to be able to put great teams on the field because they just had deeper pockets, right? So, when salary capping came in, it kind of leveled the playing field a little bit. And I think this, in a way, is a way to say to the insurance companies, listen, you can't just keep upping your CEO salaries and building new buildings on Park Avenue in New York City. A certain amount of these funds have to go to patient care, which is what it was designed for. And I think that's a reasonable way for them to say, it's not to say we're going to put a cap on anybody's salary, but it's to say, look, here's the amount of money that you guys have to work with for profit. It's still a hell of a lot of money. You guys just have to figure out how you want to divvy that up and not have carte blanche to spend it just on large buildings and management salaries.
Right. And so, now we finally get to the post that I was talking about today, is that they were asking about a certain dentist in the area.
Was it
and me? The patient says, any patients of blank, blank, blank dental practice have Delta insurance? Please respond. I have some questions for you. Well, I think I knew exactly where this was headed. And of course, reading through the comments, I was able to deduce, and I was correct, is that if you have Delta Dental, and I can say this because it is factual, in my state, I am not a provider for Delta Dental. But the majority of my patients get a check from Delta Dental for their dental work. So if I have you into my office and you have Delta Dental, and I'm going to, quote unquote, accept your insurance, that means that, let's say your care was $400 and I tell you that your portion is $100 or $75 to $100, whatever it may be. The other $325 from most insurance companies will come directly to me. However, with Delta Dental, that check goes to you. And the majority, and I will say the majority of you all, will bring that check to us or ask us what you are, what they're supposed to do with the check. And we'll say, you can cash it, write us a check. But basically, that's the other portion of your dental treatment. However, believe it or not, people, I'm going to be quite frank with you. There are people that might go to the dentist when they need money, and we may never see that money. So for the silent majority or the silent minority of you all that get that check and never send it to the dentist or never pay your portion to the dentist, there are a lot of dental offices that are charging you as a customer of that company. They're charging you up front. That does not mean that they're being horses' butts or whatever. It just means they're trying to get what's rightfully owed to them for the services that are rendered to you. Anything to say about that, Jeff?
Yeah, I mean, again, it's dentists are notoriously compassionate people. And I know that there are people who feel otherwise. But having been in education for a long time, most of us are just trying to do the right thing for people. And almost every one of us have been, nice and compassionate to the point of getting screwed a couple of times, right? With saying, listen, I want to be able to trust everybody and say, okay, I'm only going to charge you what Delta or whatever company is not going to pay. And when you get that check, you bring it to me. And then a couple of times somebody doesn't bring the check. And it's really just something that was more reactionary to say, listen, Delta made this decision to not pay any out of network provider directly. That if you are out of network, they will only pay the patient. And so that put all and it's a pressure tactic to try to get more dentists to be in network, because they either have to say to their patients, they either have to put all their trust on the line and say, I'm going to count on you to bring me that check when it comes to you, or they have to say, listen, I've been screwed over a couple of times. I just have to protect myself and my business and charge you ahead, and you will get reimbursed the other amount. But again, the piece of this that's so important to know is that, first of all, it's only a matter of timing. So if you trust the dentist, even if they're asking you for the monies up front because Delta won't send them the check, if you like that dentist and you think they do great work, why would you compromise that relationship? The other thing is, maximum allowables are maximum allowables, period. So if you have a lot of work that needs to be done, whether your dentist is in network or at a network, if your maximum allowable is $1,500, that's all you're getting. That's it. And so you're only really talking about the difference between what this dentist is charging and the contracted amounts, which are below usual and customary. And for me, if I'm having work done of any kind to my body, I don't want to go to the practitioner that says I need more people. I'm willing to do this for a lot less money because I just need to see more people, or maybe a lesser experienced person. I want to go to the best. And again, that is not price gouging. That is dentists just charging a usual and customary fee and not agreeing to an exorbitantly low contracted amount of money.
And the thing is that when we're talking about patients getting reimbursed for dental care, one could certainly question the legality of that, and it varies from state to state. However, one of the things that I do want to point out is that if I'm a provider and I have 500 patients that are on Delta Dental, that's going to pay the patient what, Delta Dental was supposed to pay us, but they're going to pay it to the patient. Let's say that 98% of those 500 people will bring the check right in, return a check right to you. But let's also say that 2% of those people, which is 10 of those people, and let's say each of them, it was $1,000. That's $20,000. That's a lot of money. Yeah. That's very costly to us. So some people feel that they need to make a blanket statement, and I fully support that. I do. I've tried to do it for years, and yes, there are times and there are people that have not paid us a dime of what they got from Delta Dental. So unfortunately, yes, the minority does sometimes rule in this situation. And we have to tell people, hey, if you're contracted with this company, and I'm not picking on Delta Dental by any means, but they do pay their consumer directly a lot of times in our state. And we have to make decisions. That doesn't mean we're going to hold the money, but it means if it does get paid to us, by no means. But I do support dentists who charge in full if you have that insurance company. And when you get the check, if you've paid in full, keep it. But always know that, there's going to be a portion that's owed to the dentist and a portion that's, that portion that's owed by you and a portion that's owed by the insurance company. And just make sure that you fully understand that before you go to a dental practitioner.
And I think if any good front desk communicator, should be able to explain that to the patient and have the patient understand. I mean, we live in a world now. I mean, Chad, I don't know if this is the same in the Fort Worth area, but there are restaurants I can't even make a reservation without paying a deposit, so that if I don't come there, they'll charge my credit card.
Yep.
And we are so not, all we're talking about is just wanting to be paid for the services provided. We're not, nobody is trying to, you
Gouge.
know, yeah, yeah. I'm just so taken back because everyone in the world has gotten to this point. Like, I can't do anything anymore without paying upfront or at the time of service. How many things do you do in your life where you are not 100% paid at the time of the transaction or before the transaction?
Well,
Right.
I agree. I mean, if we go to the store to buy a loaf of bread, you're not going to walk out there with the loaf of bread and say, "Can I make 3 payments, or can I pay you?" Or if you walk out with a cart of groceries, I mean, a lot of us wish it was this way, but they're not going to say, hey, just go ahead and make payments. That's fine. Services are rendered. We have costs that are incurred, and I'm not, once again, neither of us are trying to be horses' asses, but I mean, there's services that are rendered, and if a service is rendered, then we should, as consumers, expect that there's a cost that is incurred with those services.
Yeah.
So
And yeah. And
let me ask you this, Jeff.
sure.
Do you assign to any insurance plans, or are you contracted with any insurance companies?
We are not.
Okay.
Now, we are a community care provider for the VA,
Okay.
and that's particularly important in our area because there is not a VA dental facility in our immediate area. So they need community care clinics, and that is one area that we made a decision that we would accept contracted amounts, um, because it feels good, because
Yeah.
we want to do that, and we know what those amounts are, and believe it or not, it is not a significant discount from what our normal fees are. It is less than what our normal fees are, but it was certainly nothing. I mean, I think everybody loves to, benevolence. Like, everybody wants to help other people, and certainly, when it comes to veterans, that's an area for me that means a lot. And so anything that I could do in that arena, I was very willing to accept, the discount. In some areas, like on the preventive service, it's a little more significant. On the restorative services, not that much. But I think we just want to be able to choose, where we want to give services away or where we want to reduce our fees, and feel like we're doing good for the community, but we don't want to be forced to do it just to be able to get patients in the door. So, taking a reduction that makes our net at the end of the day zero for working 8 hours. I don't know anybody out there that wants to work 8 hours and take home zero. And the thing is that it's still a profession, and dentists also need to feed their families, do whatever, and I'm certainly not crying poverty. We have a wonderful profession where if you work hard, you can make a very decent living, but it's not without a lot of difficult decisions and without some good business savvy, because you have to, just because of where overheads are now. Just as I said, 75 cents of every dollar is going right back out the door for most dental practices.
I totally agree. And, it's, it's, it is sad. Let's switch gears a little bit, and I'm going to come back to this because as I did a search tonight, oh my gosh, in this neighborhood group, I mean, the stuff has gone crazy regarding dental insurance for the past several years. I mean, there's post after post after post after post. But one of the things that I want to ask you is is dental insurance really insurance?
No, I mean, insurance by its definition is there to prevent a catastrophic event, right? It's insurance was meant to not destroy somebody when something really bad happens, a fire, an accident, something that would otherwise, or a severe medical illness, right? Where you could go in the hospital and have millions and millions of dollars, which could financially destroy anybody. And that's what the word insurance means. It was really to prevent, financial ruin, for something that may not have otherwise been preventable. And really dentistry from the beginning, or dental insurance from the beginning, has really been more of, I would call it more of a benefit package than I would insurance. And there was a time where, you mentioned it earlier that, when annual allowables or annual maximums came out back in the 70s, each crown could cost, $100. A filling cost $25, whatever. You could work on almost every tooth in the mouth and still be within your annual allowable. And obviously salaries were a lot lower then. And basically, you might have called it insurance at the time. But with annual allowables of $1,500, which we all know is one tooth in today's environment, and it doesn't matter where you go, that's one tooth that needs to be fixed. And so insurance is really more of a benefit than it is true insurance. Anything that puts a cap on what you're allowed to spend, or what you're allowed to be recouped for, is really not true insurance. It's not preventing any kind of financial ruin or financial hardship.
I love your answer, and I would say that you referred to it as a benefit plan, but a lot of people refer to it as a prepaid benefit plan. So let's talk about that for a second, because is there anything that your office has done for those patients that don't have dental insurance?
Yeah, I think a lot of offices have done this now. We have something called the Advanced Dental Plan, where the patients can basically prepay for their cleanings every year. So they prepay what the fees would be to get two cleanings a year with the x-rays and everything. And by doing that, now they get 10% off of every single thing that we do within the practice. And regardless, that there's no maximum allowable to that. There's no, this is just an in-house benefit plan. And many patients, by the time that's done, will get way more than the $1,500 or the $2,000, especially if they need a lot of care. There's no cap on the amount of dentistry that they can have or will need with that. But we've offered that for several years, and that's been just amazing. Every day people come to me and say, "Oh, well, I can't get my cleanings because I don't have insurance." I'm like, just paying for your cleanings is more insurance than most people have by today's standards, because it's going to prevent so much. So if you will just say, yes, I will pay for 2 dental checkups a year, 2 cleanings a year, checkups, x-rays, you're going to get that discount on everything across the board. There's nothing that has to be pre-authorized. There's no, I mean, it's just a straight across the board thing. And I really do believe that we're at the point where dental insurance is going to have to reclassify itself as a dental benefit plan, not dental insurance, and get more creative. Because how many people come in and say, well, I can't do that, I don't have insurance, I'm going to go buy insurance. Well, you and I both know that anybody who pays for dental insurance privately will end up spending more than they will ever get back in return from that
more
insurance.
stipulations too.
Right.
Right.
Yeah. Exactly.
So we do the same thing. We offer what's called a smile plan, and it's very similar to what you said. And a lot of offices are doing this. So if you're a cash pay patient, or you've lost your job, unfortunately, you don't have dental insurance for whatever reason there may be, ask your dental providers. I mean, we not only offer a benefit package at our office in terms of a smile plan, but we also do offer cash discounts. If you're willing to pay cash and you just want to pay cash out of pocket, you don't even want to pay the upfront smile plan, we offer a cash discount as well. The reason being is that it is so much more efficient for our office to not have to go through insurance, that it's financially advantageous.
Hey, let me clarify something too, just because you said cash. Chad is not referring to cash, roll the dollars out. I just wanted to clarify that. So
no, it is meaning that you pay without insurance.
Thank you. I didn't want to get you in trouble with the IRS was about to come knocking at your door, Chad.
No. Sorry. Jeff is very correct. It is not, we do not accept cash under the table. Everything is registered officially. But the point is that if you want to be a quote unquote cash pay patient, meaning that you are coming to our office without insurance, we will offer you a discount if you pay for services up front. We also offer financing plans in our practice. There are several lenders out there that cater directly to dental patients that are. I mean, granted, they're not going to give you $100,000 that I've seen. I'm sure it's out there, but we do have Care Credit. There's Cherry. There used to be City Healthcare. There's other companies out there that are specifically in the healthcare industry. You know, I mean, shoot, Care Credit is wonderful. They've been great in our practice. And who eats the cost on that? Not the consumer, the practitioner. And that's okay, because it allows you to receive the care that you need. The point is that just because we don't accept your insurance plan, or we aren't assigned with your insurance plan, we all have our own reasons for that. It doesn't mean that we're bad providers. It actually probably means that we're pretty damn good providers. We just have some business savvy, and there's reasons that we don't need to assign. We don't want somebody telling us what we can and can't do. We also, we're going to do what's best for you. Both of us run, and I can say this without even asking Jeff this, both of us run patient-centric, health-oriented practices. We're here for you. We're not here for your insurance company. We're here for you. And that brings up kind of the final point of the evening. Why does an insurance company deny something? Is it because it wasn't necessary?
It could be because they don't want to pay.
That could be. There's a number of reasons. But my point is the insurance companies will even tell you, just because they deny something, they're not making a treatment based decision. They're making a financially based decision, or a it doesn't meet our standards based decision. So that's one of the most frustrating things as a practitioner, and I write so many letters to dispute and argue and fight for you, the patient. And I know Jeff does too. We are always looking out for your best interest. Every good-hearted dentist out there is looking out for your best interest. Because an insurance company denies something, it does not mean that it wasn't clinically necessary. Just going to say
Absolutely.
it out.
Yeah.
I mean,
And let me piggyback on you too, Chad, and I mentioned this earlier, and then I know we need to wrap it up here soon. I just want to reiterate again that annual maximums are annual maximums. And listen, if you find somebody that's in network and you feel like they're a great clinician and you're comfortable with them, please, that's wonderful. That's great. But don't not go to a trusted dentist. Don't terminate a relationship with a trusted dentist, with a great clinician, over the fact that they may not be in your network. Because while they may have a slightly different fee than the contracted amounts that a participating provider may have, you're still only going to get the $1,500 per year. And so you're talking about typically a very small difference out of pocket at the end of the year. Just the differences in whatever those contracted allowable fees are. And, for the peace of mind and having a clinician that you trust, just I wouldn't let that cloud my judgment.
Jeff, you stick the words right out of my mouth. And as we're closing, I have 2 points, and that was the first. The first is that go to somebody that you trust. There's if you're going to go to the neighborhood page, please don't start off with, does anybody know who accepts my insurance? The first thing is, does anybody have a dentist that they love, that they feel at home with? Our patients aren't just patients, they're our family. I mean, I saw somebody last week, and I was able to do something fantastic with them that changed their life. They've been with me for 25 plus years. I consider her a sister, a mother. She's family. She's part of our dental family. That's part number one. Find somebody that you trust, that you know is going to do the right thing. If you don't have somebody, find somebody that's your community, that's your friends, that they trust and that they feel comfortable with, because dentistry is not a fun place to be. I mean, the dental office, we know that. I mean, as patients, we know that. But you know what? Go somewhere where you know you're going to be well taken care of. But the last thing is this: dental insurance should not be viewed as a financial benefit nor a healthcare decision maker. The challenge for both patients and us as providers is learning how to navigate a system that was never designed to support the complexity of modern dentistry. Dental insurance is for lack of a better term, it's a discount plan. And so utilize it as such. If you trust a provider and you have questions about insurance, I can tell you that my team and Jeff's team field questions all day long when it's open benefit enrollment at the office. Hey, I have these 3 insurance plans to choose from. Which one should I choose? Well, if you choose these 2, you're going to have to find another provider, which we'll be happy to help you find one. But if you choose this one, you can keep coming to us. I hope that they all say, then that's the one I want. I want to be able to keep coming to you. We'll always have your best interest at heart. And, we know that insurance is necessary in life. We know it from a medical standpoint, and we know it from a dental standpoint. But please make wise decisions and choose your healthcare providers and your dental providers based upon people that you can trust, rather than just somebody that checks the box and accepts your plan.
Love it. And to all of you, thank you for listening tonight. Thank you. We're going to have a lot more in the world of podcasts and webcasts on YouTube. A lot more content coming for you, the patient. So look for us. We are Dentists in the Know. We also go by Dinks, D-I-N-K-S. And when we started this cool little group, Chad said to me, I like this term. I like Dinks. I think that works well. And I said, well, Chad, everybody's going to think that's double income, no kids. And Chad said, Jeff, you are old. That is an old term, and he's right. Maybe I am showing my age with that. But some people remember what Dinks were, double income, no kids. And now Dinks has made a comeback in the world of pickleball.
I was just going to say the same thing. Yep.
Yeah. Yep. Yeah. But anyway, we are hashtag Dinks, Dentists in the Know. If you have any questions or any topics that you'd like for us to share with you, like for us to discuss, we're an open book. We'd love to hear from you. And we thank you for watching or listening today. And we hope you have a great rest of your day.
Good night, everybody. Thanks for joining us.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.